Okay, so we have Kathy here. Kathy, what brought you into the office originally?
Well, originally I was a patient of Dr. Lavin's for years, who I totally loved, and I decided to try the new chiropractor. And I was astonished because she totally does things differently than the other chiropractor. And I asked her, "Are you done adjusting me? You didn't crick my neck." And she said, "No, we're done." And it didn't hurt. I didn't have to put ice on afterwards. So the new way, I'm totally sold on.
And was there an area that was acting up that you routinely had?
I have a chronic neck problem that I injured years ago when being pulled out of a pool by my son with one arm, and it injured my neck. So it gets really bad, especially if I lift something heavy.
So when it's acting up, does it affect you on the day-to-day, like getting things done, or?
When it's acting up, I get so bad that I get a headache that progressively gets worse and worse until I finally come in and she adjusts me, and then it totally goes away.
Okay. Sounds great. And had you tried anything before chiropractic care to handle the neck
Well, we
pain?
didn't know what it was. From the time that we had the injury, I went in and they were going to even do an MRI because before I ever was adjusted, it was so far out. After this happened, for about a year, I was in pain, and about 3 o'clock to 5 o'clock, I could hardly sit at my desk.
Wow.
And finally, one day, my sister said, "Maybe your back's out or your neck's out." I'd never been to chiropractor. And the first time I went, right after that, I could feel the blood just run right up after
Wow.
the adjustment. My ear was numb, my neck was numb. So now I'm pain-free.
Awesome. And is there anything that you can do now that you couldn't do before, you know, getting chiropractic care or even the activator care when you switched over?
Well, the main thing that I like is sometimes it was getting so that if I get a bad week where I've had to help somebody move or I had to do a lot of things using my upper body, which will kind of put my neck out, then I come in a lot. And I was dreading coming in a lot because in the old way, when they jerk your neck so violently, you go home and you either put ice on it or whatever. Now, one time I think I came in 3 times in 1 week and had Dr. Martin adjust my neck, and you go home and there's no after effect. I can still go on with my day and not feel like I need to lay down and put ice.
Great. And what would you tell a friend who was maybe considering trying chiropractic care, never had? What would you tell them?
That I'm really, really pleased that I stayed and I gave Dr. Martin a chance, because the new way was so different to me that I kept thinking that this just couldn't possibly be right. It was so simple to just use this little tool to put my neck back in versus the terrific, cranking of the neck, which kind of scares me. I always worry about paralysis and things like that. So I think this new way, I've already sent in 3 people to Dr. Martin and recommended the new way.
Thank you.
And my husband has too, because he's quite impressed also. And after I go home, my neck's back in and I feel great. I can continue my day.
Perfect.